Glad we're on the same page there. Okay. Good evening to you guys. Good morning for anyone in Australia, which I'm sure there's probably not many people here. Thanks to Trauma Care for having me speak today and this opportunity to present my research to you. So this is the focus of the recent paper I published, which I'll go into in a fair bit of detail in this chat. Before I kick things off, I just, in Australia, it's common to do this. So I just want to acknowledge the traditional owners and custodians of the land where I'm currently sitting delivering this talk, which is Tasmania, Australia. They have been here for thousands of years, and I pay my respects to Indigenous elders past, present and emerging as the holders of culture and knowledge. Sovereignty of this land has never been ceded. It was and always will be Aboriginal land. So this is an overview of what I'm going to cover today, just to give you a bit of background on mountain biking and what I found in the literature on mountain biking, and a bit about my PhD research, which I'm conducting at the moment. So just a bit about me. The relevance of this topic to me, I've been an emergency nurse for 20 years or so, working in different emergency departments. But for much longer than that, I've been a regular mountain biker. And in my clinical role in the emergency department, I've always taken an interest when patients presented with a mountain bike injury, just because I could relate to them. And in the last few years, I still maintain that interest, but I just can't keep up. It seems like there's so many more injuries, certainly in Hobart, where I live. And physicians all over the hospital have started chatting about how they, in orthopedics, in anaesthetics, in ICU, we're seeing more neck and spinal injuries. So I wanted to find out if there is data to support this observation. So I wanted to find out if the severity of injury is changing in mountain biking, because back when I first started mountain biking, no one was dying from mountain biking in Tasmania, and the most injuries you saw were quite minor, and certainly not massive head and spinal injuries. So I just wanted to see if we had data to support that. So just some things to keep in mind during my presentation today is have a think about taking risks, and in mountain biking, deliberate risk taking is at times quite integral to the sport. So consider what level of risk is acceptable in a sport like mountain biking. And there are other sports like it, skiing, snowboarding, skateboarding, those sorts of things. But I think mountain biking's something that's seen increasing growth, and I'll talk about that too. So just to give you a bit of context on what mountain biking is, well, it became an Olympic sport in 1996 and has seen increasing popularity since. It's now one of the fastest growing recreational sports, and that's demonstrated by growth in bike sales internationally, with a lucrative industry developing around mountain biking, including the range of bikes available, clothing, trail development and tourism. Participation rates are difficult to quantify because mountain biking can be quite informal, but bike trail counts in the US, for example, are showing yearly increases of more than 100%. Mountain bike usage has increased by about 25% in the US over a decade. So it is an increasing sport, and where, trail usage has not been monitored in other places, but that's good to see in the US. Development of mountain bike parks has happened. In Australia, for example, there was recently $100 million in 2020 of government funding for various mountain bike parks across Australia. So it is an area of growth and priority. And mountain bike parks usually offer graded trails for varying abilities and different riding styles. There might be skills parks, jumps trails, and adjacent facilities like bike hire, cafe, first aid. So as we've seen the recent development of mountain bike parks, there are now more than 250 worldwide. You probably know some in your own areas, and many ski resorts are now offering lift access mountain bike trails in the summer season, which is a really good way to get revenue in the off season. And then sub-disciplines have emerged in mountain biking, which weren't really there before. And that's that list I put there on the slide is not exhaustive. Recreational mountain biking happens in many different forms, but that's more the competitive sub-disciplines. So the emergence of those sub-disciplines is relevant. We've seen a movement from predominantly cross-country riding to more extreme disciplines, which involve downhill riding at speed with obstacles which mean they can carry a higher degree of risk. So bike technology, protective equipment used, and the riding style alters between these sub-disciplines. This slide shows some of them. Once again, these are mainly the competitive ones. But they do represent the changes we've seen in mountain biking over the years as more people are getting into the sport, which means accessibility of the sport is in a wider variety of people, and the risks and the people exposed to those risks is changing. So this was the overall aim of my PhD research. And overall, we want to understand how and why severe injuries occur so that we can address any contributing high-risk factors and reduce the burden on healthcare. So I'll talk about Tasmania a bit later and what we're doing here, but I'd like to discuss what I found looking at the current body of literature on mountain bike injuries, which was the focus of my recently published paper. Here's a link to the paper. I think you already have it in the show notes as well. We published this paper in December last year, along with my PhD supervisors, James Sharman and Viet Tran. We looked at existing literature to identify what's currently known internationally on the health service impacts and risk factors of severe mountain bike injury to determine the future directions. So we looked at research papers, government documents, and grey literature from database inception to July 2023. So all that's included in these papers. There have been some more recent studies after that, which I'll talk about too. So we used the following search terms and found that in addition to a few review articles, there are about 23 published research studies into mountain biking. It's not a huge body of literature. And of these, 17 included some data on severe mountain bike injuries specifically. Of these and other 5 papers identified healthcare impact concerns in their discussion, although they hadn't looked into it specifically. Other than research review articles, I didn't find any specific research on the impact of mountain bike injuries on healthcare services. So this is a summary of the findings of my literature review. So mountain biking has seen increasing injury rates, which are relatively high compared to other sports. However, we do know that participation is increasing, but quantifying participation remains problematic due to that informal nature of mountain biking. Numerous studies have researched injury incidents in mountain biking. There've been a couple focused on downhill and enduro and mountain bike park riding. The methodology in these studies differs a lot, with some using retrospective medical chart reviews or surveys at events or questionnaires, but different methodology. So comparison is quite hard. Injury reporting differs between the studies too. Healthcare impacts were rarely documented. There was little mention of pre-hospital care, the cost of medical treatment, or resources involved in the care of mountain bike injuries, and even from a trauma perspective. Most studies have found that severe injuries are more common to the downhill disciplines, which leads on to my next point, that mountain bike parks are an emerging source of injury, and they do tend to focus on that gravity downhill sort of riding. There is a lot of variation in how the studies have defined severe injury. Some use the injury severity score, the ISS. For example, in Australia and New Zealand, the trauma registry, which is used to record trauma injuries, uses an ISS of greater than 12 to identify severe injury or death. But some of the other studies I reviewed base severity on the need to transfer patients to a trauma centre or by the need for admission to hospital. So different there. Some studies do use the ISS with different thresholds. Studies identified the modifiable risk factors to be trail design, trail classifications, and rider skill levels, which I'll talk about in a bit more detail. So what do we know about mountain bike injuries? Well, according to the latest Australian data on sports injury-related hospitalisations, cycling has the highest rates of injury. As you can see from that graph there, cycling way ahead of any others. That's not so surprising considering the increasing popularity in the sport and the advancements in bike technology and accessibility of mountain biking. This data doesn't show us anything about mountain biking specifically. They're included in that cycling range. So it's been found that the most common injuries are minor injuries, bruises, lacerations, overuse injuries, those minor sorts of things. In terms of traumatic injury, shoulder injuries are the most common, with the clavicle being the most common fracture site, followed by scaphoid and distal radius. So upper limb, very common. This infographic depicts the findings from a really large study of 2,000 riders in the Enduro World Series events. And it was a mixture of amateur and elite, but all those riders were competitive in those events. These findings are consistent with other studies, though, which have found similar things, including my own study, in terms of those upper limb injuries. So the US have looked at the National Electronic Injury Surveillance System, which looks at ED emergency department presentations from a large representative probability sample, and they've come up with similar types of injuries. I don't know why that went on to the next slide. So there have been numerous studies on cycling injuries, like I could find 180 or so, much less on mountain biking exclusively, and some of the mountain bike ones have focused on case studies or just specific types of injuries. There have been studies into recreational riders only, and others look at competitive data with data collection conducted at race events like the one on this slide. And that's just mainly to do with it's much easier to capture your sample at a competitive event than it is with recreational riders. Not to say it hasn't been done. So we're looking at severe injuries. Head, cervical spine and chest trauma are most commonly associated with severe morbidity and mortality. However, in comparison, it's hard to work out. You can't compare the different studies due to that heterogeneous types of data collection and classification of severe injury. So the table here I've included as an example of the sorts of injuries that were seen at Whistler Bike Park in a single summer season. Now, Whistler Bike Park is in Canada. It is one of the earliest and the most popular mountain bike parks in the world. And they do have a clinic nearby in the town which sees those mountain bike injuries. So a recent publication looked at fatalities in recreational mountain bike in Austria over the past 16 years, and they found 97 fatalities over the time period, but more than half were the result of non-traumatic events like cardiac arrest on ascents that occurred during mountain biking. The traumatic fatalities were mostly while riding downhill. There is no internationally consistent injury severity rating. And as I've mentioned, those different types that different studies have used. One retrospective cohort study over 14 years in Canada compared severe injury patterns between street cyclists and mountain biking. And looked at risk factors and the incidence of severe injury, and findings were similar to that Whistler study. Severe injury patterns were similar in both cohorts, with head injuries at 67%. Spinal injuries were more common in mountain bikers than in the street cyclists. Spinal injuries are infrequent, but they do occur. And some studies have reported that almost half that get spinal cord injury have ongoing paralysis. So I think about that in terms of healthcare cost of severe trauma. I've also put in there geographical location of mountain bike trails as a risk factor for severe injury. In terms of a general trauma management perspective, we can assume that remote location of trails may contribute to slower retrieval times, which may mean less favourable outcomes for the patient. Complex trauma, often associated with increased risk of hypothermia, hypertension, hypovolemic shock, those things that when there's a time delay to definitive care, patient outcomes are affected. So the main risk factors for severe injury across the board with the studies is downhill and speed. So the overall injury rates in downhill and freeride discipline is higher, with a higher chance of severe injury, and that's because they involve those two things. The highest risk of morbidity and mortality is related to head, neck and chest trauma, with the most common mechanism being falling forward over the handlebars, which is why I put that photo there. So one study found that injury rates are 17 times higher in the downhill disciplines than with other disciplines. Any references for these are in my paper, and also I'll show you them at the end. So what do we know about the causes of mountain bike injuries? Well, most people are riding, more people are riding, and more people are getting injured. So we know that. In a 10-year study of trauma centre admissions in Vancouver, there was a 3-fold increase in mountain bike-related injuries over the 10-year time frame, which was 1992 to 2002, so quite early on. And mountain biking is a growing cause of severe injury. This pie chart shows the most common causes of mountain bike injury. It summarises survey results from 250 riders in downhill riding only. And it shows the rider-reported crashes were attributed to riding errors mostly, and trail conditions, 47%. They're the two biggest contributors. However, in some of these cases, there was more than one cause identified. So riding errors were often related to rider experience and ability. So rider lack of skill or choosing trails outside their skill level. That Whistler Bike Park study I mentioned previously identified trail design and rider ability as potential areas of risk and identified the needs for these to be considered in future injury prevention programs. In terms of trail condition and obstacles, technical terrain has a big impact, and poor trail conditions could be caused by ruts in the trail, weather, all those sorts of things, and much more relevant when speed and downhill over technical terrain is the case. So mountain bike parks were identified in 3 studies as an emerging source of injury. A Canadian study looked at trauma centre admissions at hospitals in area where there was a high density of mountain bike parks and trails, and they found injuries were increasing. They recorded 1 death and 12% of each of head and spinal injuries. So bike parks are a significant cause of injury in the 10 to 19-year-old category, that age group being more vulnerable to head and traumatic brain injury. But also no one's looked at risk-taking in that age group, which may be higher and may be fueled by social media. We don't really know. Mountain bike parks, as I said, often shuttle access gravity trails, which is opening up speed, downhill and technical trails to more riders. You can just get the shuttle up and get down, and they are increasing people to being exposed to risk factors. From a health perspective, safety is easier to manage in mountain bike parks. To the next slide there. So it is easier to put in safety considerations from the outset. So we can have things like helipads, safety retrieval points. Often there's first aid patrollers able to go on those trails, which is something you don't get in recreational mountain biking. It was noted in the literature that mountain bike parks are sometimes reluctant to release usage data to support injury surveillance. I didn't find that surprising either. No one wants bad press. But we can learn a lot from mountain bike parks and the way they manage things. So when I talk about my research, people often ask how it compares to other outdoor sports in terms of injury rates and risk. There's not been a great deal of research into it, but some disciplines of mountain biking are classified as extreme sports, meaning they involve a high degree of personal risk. Severe injuries in mountain biking are already at the high end of outdoor sports, but compared to road cycling, fatalities in mountain biking are still rare. This is just a study I'm sharing related to head and neck injuries. The data is from 2010, but you can see that in comparison to other extreme sports, the rate of mountain bike injuries are quite low, but mountain biking had a relatively high risk of neck fractures. Helmet use is quite protective against concussions, but they do still occur. In terms of age and sex differences in mountain biking, women constitute a smaller proportion of the mountain bike population, but have higher overall injury rates to men. A 2024 study, not included in my literature review as it's very recent, it's just been published. So it found that female athletes have a 2.89 higher risk of injury compared to male downhill athletes, and females have a higher risk of head and neck injuries and concussions, and overall more serious injuries than male riders. And that's similar in injuries to youth. It is possibly that lighter body weight might mean that women are more likely to go over the handlebars, putting them at risk of head and neck injuries, but really more study needs to be done to see if that is the case. 30 to 39-year-old males were the most commonly injured, but severity was higher in the 21 to 30 age group, with a higher number of trauma centre admissions in that age group. Injury prevention and safety measures. So protective gear, helmet use is high in mountain biking, about 88%, but still head injury and concussion are common. A large study in the US found young riders at higher risk of those things, but more detail needed to understand why, whether it's due to anatomical reasons or the mechanism of injury. And in terms of what we can do, there's trail difficulty ratings and signage. So for riders, riding within one's level of ability is important for safety, and signs that provide info to help riders choose a suitable trail are really useful. This slide shows the International Mountain Bike Association standards, which have been adapted from the trail marking system used universally in ski fields. So whilst many mountain bikes parks have adopted that similar signage, it is not used universally internationally or on mountain bike trails, but you do see it quite often. So there have been some research into risk factors for mountain bike injuries, as I've discussed, and how riders perceive the causative factors in crashes. So how can we manage risk in mountain biking? Well, an understanding that mountain biking is inherently dangerous. There are unavoidable obstacles, changing trail and weather conditions, and risk is part of the sport and might even be the attraction of it. So that is an understanding. Protective gear, we can use as much protective gear as possible, but whatever we do, safety is the responsibility of the rider, just to put that there. So trail design we could do as well to reduce speed into technical sections. There hasn't been research into this, but we do know that speed, downhill and obstacles contribute to injury. So reducing speed into those sections would be helpful. Trail classifications are useful, having them there, safety signs could be useful in helping riders decide which trail to ride. Skills education and training, we do it in ski resorts. You go onto a ski resort and most people grab a lesson before they get out on the slopes. Not so in mountain biking. Some mountain bike parks offer lessons, but it certainly wouldn't be the routine that you turn up at a mountain bike park and go for a lesson and have that bike school. It is available in some places though, and that sort of thing could help with risk in the sport and choosing what trail to ride. From an emergency management perspective, planning for accidents, knowing the data, what sort of mechanisms we're likely to see, and being prepared for that in terms of resource planning, emergency retrieval points, local healthcare resource planning, and learning from the mountain bike park model, which often use really solid safety models. So now you know a bit of the background on mountain biking. As it's often steep on difficult terrain, provision of treatment and retrieval can be quite problematic. However, there is really little research on how mountain bike injuries are impacting healthcare, and as a growing sport, that is an area of future research, because injury severity, if we're seeing more of it, that's likely to compound the healthcare burden. So we know from one study that looked at a nearby health facility near Fort William Mountain Bike Park in Scotland during a World Cup mountain bike event, that race weekends saw a 28% increase in presentations. And they found that even small increases in presentations can overwhelm local health services. I don't know what it's like where you work. We are certainly prone to bed block and overcrowding here, and to have a mountain bike race nearby and to see increase in presentations is likely to have a big impact. Not to stop those things, but to be aware of it and aware of the types of mechanisms we might see. So as a healthcare professional, we're not always expecting big types of injuries in mountain biking, and the types of trails that are being built are evolving. Previously in mountain biking, we saw maybe minor injuries, and now we're seeing people fall onto their head and neck from great heights up to 6-8 meters in the air with that huge axial load from huge heights. So I don't know about you, but we see a lot of that now. So when looking at the literature, I found that many of the data sources were healthcare records, and a lot of injury surveillance had been done, but how the number of injuries potentially impacted health services was really rarely discussed. This slide shows the literature that noted healthcare impacts in their recommendations, but this was as much detail as they went into. There was no data for it. While it's evident from the few studies that have discussed healthcare impacts that mountain bike injuries can significantly impact emergency departments and hospital admission rates, the cost of injury, pre-hospital care, and impact on local health services were not exhaustively covered in any of these papers. We do know that generally trauma costs are influenced by severity of injury. Cost is influenced by the mode of transport to hospital, the age of the patient, the treatment given, and whether it's polytrauma. We also know that there are longer-term healthcare and social costs, especially in things like brain and spinal cord injury, where those social costs are quite high. So in terms of knowledge gaps, it's unknown the social and economic cost of severe injury in mountain biking. No studies have assessed economic cost of mountain bike injury to healthcare, but also the cost to the individual in terms of time off from riding, from employment, and impact of long-term disability. Severe injury is poorly defined in the literature. There are no international injury classifications. There are, sorry, but they're not routinely used in these studies. Literature with a focus on healthcare impacts is scant, as I've said. Many studies have investigated incidence, characteristics, and demographics in mountain bike injuries, but studies into risk factors for injury are less common and may be changing as the sport develops. New styles of trails, bikes, e-bikes in particular, e-mountain bikes, all might have an impact on risk factors in terms of they get people up hills onto steeper remote terrain. Mountain bike parks are an emerging source of injury. but injury surveillance needs to be ongoing to see if that is changing with this evolving sport. So what we don't know is what the acceptable risk and injury rates in mountain biking are. Like, we have to accept there is going to be injury in a sport like this. Considering that severe injury is likely to have the higher healthcare impact, we don't know specific risk factors involved in severe injuries specifically. We don't know injury rates related to mountain bike parks and how these might be changing the emerging subdisciplines. And issues related to first aid and mountain bike park risk management and response to severe injury, haven't looked into that. And issues related to health service management of mountain bike injuries. So how do we support all of those things but not close down trails is the important thing. We want to reduce the impact on healthcare without changing the way people ride and their enjoyment in riding. So just to bring this all back to Tasmania, which is where I live and where I've collected data on mountain bike injuries, prior to my study on my data surveillance on mountain bike injury independently of other trauma in Australia, there was no data collection on mountain bike injuries. The statewide trauma registry started only last year, so we didn't have trauma information prior to that date. For those of you who don't know, Tasmania is an island state at the bottom of Australia. It's a population of 500,000, pretty small. It has really steep and varied terrain, which lends itself well to mountain biking. And our healthcare system is subject to chronic bed block, ED overcrowding and ambulance ramping, which I'm sure is probably common to some of your healthcare settings as well. All public hospitals in Tasmania are run by the same health service. And so from a data collection perspective, this was useful. I could collect data from all the public hospitals. So I've collected data over a 14-year period and got 6,000 mountain bike injuries from 2010 to 2023. Mountain biking truly got established in the state from around 2015 onwards, when the federal government invested money in trail development. So alarmingly, there's been, since 2018, we've had 3 deaths on mountain bike trails in Tasmania, which is a lot in a sport like mountain biking, and more than 20 have had severe or life-threatening injuries. They're mainly spinal cord injury. So we need to understand whether mortality and morbidity are increasing, and the severity. What I want to see is whether the severity of injury has changed over that time. There's no statewide approach to trail signage nor access for emergency services in many areas, which might contribute to delays in getting patients to definitive care. In Australia, Tasmania is used as the case study for the success of mountain bike tourism. However, on the flip side, there's no data for it. And in 2017, the Tasmanian government released a cycle tourism strategy with no future directions for mountain biking in relation to healthcare, nor was healthcare identified as a key stakeholder. So this is the aim at the moment, to determine the prevalence of mountain bike patients presenting to emergency departments in Tasmania. The data collection is from emergency department presentation records, and the participant inclusion criteria are quite broad. Mountain biking is the primary cause of injury, or injury occurring on a mountain bike on an unsealed surface or purpose-built trail. And these are the sorts of numbers I've got so far. This is the data extraction. We are presented with similar challenges to those found in other similar studies. Identifying cases is reliant on the quality of the triage nurse assessment or medical notes and what was documented there in terms of what type of riding the patients were doing at the time, the mechanism of injury, the location where it happened. It all has to be in the medical notes, or it can't be recorded. So you can see that I've identified 6,000 cases that were definitely mountain bike related, but there's another 4,000 or so that we couldn't work out what type of riding the patient was doing. So that is a limitation. Just a quick look at the participants of my study in terms of the percentage of mountain bike injuries by body region. It's similar to other studies, considering that severe injuries are mainly thoracic, abdominal. They're definitely less common than those minor injuries in the upper limbs. This is a quick timeline of very generally of mountain bike injuries in Tasmania and when the major trail networks were opened. So Derby is like an internationally renowned trail network where they've had a lot of international races that opened in 2015. And then a private bike park with the longest descent in the Southern Hemisphere. So lots of descending trails, all gravity, opened in 2018. And we've seen rise in injuries since then, and that could be due to participation as well. And then COVID, 2020, injuries have dropped off a bit since then. During COVID, Tasmania borders were locked for, I feel like 2 years. I'm not sure how long it was, but locked for a long time, which meant people in the state were travelling to those mountain bike destinations because they couldn't leave the state to go anywhere else. So my main limitations is that I've been unable to capture GP presentations or presentations to private hospitals, but it's likely that we have captured all severe injury presentations, as these usually end up at one of the major hospitals, which are the major trauma centres. As these ones have the highest economic and social cost, it's the ones we care most about understanding the healthcare burden of. But we are limited by the lack of documentation on many presentations, especially prior to 2012, before notes were digitally scanned. There's no record. So in terms of conclusions and future directions, and this is from my literature review, but accurate and current injury data on mountain bike injury is needed. Then we can be better prepared as healthcare professionals, but also riders can make informed decisions about participation in the sport, and we can direct targeted safety measures and injury prevention strategies. There needs to be effective surveillance of mountain bike injuries, which requires a more consistent approach to hospital documentation and the establishment of a reproducible definition of severe injury. Evaluation and learning from mountain bike park model, and in terms of understanding causative factors, that would likely involve both quantitative and qualitative approaches, which not many studies have done. And effective risk management strategies will require collaboration between healthcare services, mountain bike parks, the mountain bike community stakeholders to ensure that there are adequate resources available to meet the growing demand. Electric bikes, have to mention them. They've seen a steady annual increase in sales, and that's not just the road electric bikes. These are mountain bike specific electric bikes. More people are accessing them. They're heavy. They can go fast. They can get fast up hills. They can get high into the air like any other mountain bike. So it's something to keep an eye on. It'd be useful to see if age-related risk of severe injuries would also be useful in that space with e-bikes. So that really comes to the end of the findings of my literature review, but my aim today was not to dissuade anyone from mountain biking. I'm looking at enhancing safety in moving forward with continuing popularity in this sport. It's changing and it looks to remain quite popular. So we need to have a look at what's happening into the future. The injury-related cost of care for mountain bikers and healthcare costs are outweighed by the health-related benefits of riding a bike, undeniably. So despite being an inherently risky sport, you're still 420 times more likely to die from physical inactivity than you are from mountain biking. So I just want to leave that with you. There's references, but they're all in the paper. If you follow the link, you'll see the full list. So up for questions, please get in touch with me anytime if you'd like further information. My email address is on the paper as well.
Brilliant. Thank you so much, Jill, for such an informative webinar, really. I was gonna say paper then, but no, we are definitely on a webinar. So let me just grab this correct screen and hopefully it is shared. It is wonderful. So as always, just before we move on to the Q&A section, I just want to draw everyone's attention to our next webinar. If you were lucky enough to join us in Ireland, you will have seen Morgan speaking live, and I was lucky enough to catch the end of this webinar and left unable to talk. Basically, it hit me. It really hit me. So straight after the conference finished, I emailed Morgan and said, please, can you do this as a webinar? And he very quickly agreed, and we've booked him in for 2 weeks' time. So do scan the QR code that's on your screen now and join us and Morgan McMonigal, who is going to be talking to us about trauma in war and austere environment. And not only that, but he will actually be drawing upon his real life experience in this as well, as he is a humanitarian surgeon that works with people like the David Knott Foundation, the ICM, all sorts of wonderful different places. So do consider joining us in 2 weeks' time, on October the 3rd, for what is going to be a very profound talk. And that brings us on to the Q&A section. Now, someone did ask a question pretty much right at the beginning, and you all know by now, if you're not a trauma care member, this is your chance to scan the QR code that's on your screen right now, and this will take you through to the feedback form for you to fill out to get your CPD certificate if you are not a trauma care member. If you are, do hang on until tomorrow morning, and I will be sending them out then. So, and a question that has come in from Fleur is, do you think brands that sponsor professional riders should take more responsibility when pros post their crashes, which portrays their injuries and crashes through a glamorous lens? So do you think they should be calling out the riders a bit more, basically, to be like, don't do that?
It is horrific, what people post online. Yeah, it's a hard one. I'm not sure. Like, I think there are sites just for the crashes, right? And some of them, yeah, look like those people have been injured quite badly. Maybe that's good learning. I don't know whether people learn from that. I think there's a lot to be learned from social media in terms of how we portray risk on there, and if that's increasing risk in young people, because my son, for instance, he's in the earlier photo getting air in my introduction slide. He's about 8 meters in the air or something, and he puts that online, then his friends put it online, and they all want to go and do that jump because he got so much air. So, I think social media maybe has a lot to answer for. I'm not sure. And in terms of putting crashes on there, it's there perhaps needs to be some sort of censorship, and I'm not so sure the guidelines around that. I'm sure there is some, but yeah, good point.
I think from my perspective on that, in that I'm in marketing and also have to sort of be very conscientious of what we're posting online and stuff. I think for me, if I was on marketing for a brand and I saw one of my members, and I am speaking purely from not a medical point of view, but from a sort of brand conscientious point of view, if I saw one of my riders sort of with my brand flashed across the thing and they were crashing, I wouldn't be tempted to sort of say, please take that down or anything. I think it's more maybe putting a warning on there or putting some kind of caption on there that does kind of go, I'm part of this, but also this is how it happened, and please don't attempt it, kind of a Jackass moment where it is, this stunt was attempted by professionals, do not attempt to do this own kind of thing. So that from my marketing point of view, Fleur, I'd say that's probably it, more putting a warning on there more than anything. Maria, for your CPD points, they come automatically with the certificate. If you are a member, your points will be on there. If you're not a member and scan the QR code, the points will be on the bottom of the certificate and it'll show up there. Mark has asked, does RHH have heads up to events like Alice Springs does with Finke?
Yeah, I saw that question pop up. So the RHH is the Royal Hobart Hospital. Yes, it's not legislated anywhere. It is just a courtesy call. A lot of the paramedics who work at those events, or the doctors who go and help out at those events, let us know. And that's just because they can relate. They often work in the emergency department anyway. And they do give us a heads up that there is a major event on and that we may expect more injuries. And often it's like even just the number of people in the crowd and you get people slipping over and that sort of thing means there's injuries as well, not just the mountain biking ones. Yes. But yeah, it's like one company has just started doing specific mountain bike events, first aid, and they'll be very good. But yeah, it's certainly not legislated anywhere that they have to let us know.
Fair enough. Fair enough. So Caroline's asked, what are your top tips for engaging MTB parks in accident reduction?
Oh, so they do it quite well because obviously generally it has to be planned in advance. The trails are planned, they're mapped out. We can really learn a lot from them. What was the exact question again? Sorry.
What are your top tips for engaging MTB parks in accident reduction?
Yeah, so I think it's really important to let them know that by collecting data on mountain bike injury and asking questions about mountain bike injury, we're not trying to shut down trails. Like I want to make that very clear. Like I'm a mountain biker and in my own state, it's not like I'm going to want to be pushing to shut down trails. I think teaching them about what's involved in retrieval of trauma patients and the sorts of severe trauma we're seeing, like severe injuries, and how we can reduce that. So trail speed is important. If we know about the risk factors, speed and downhill, obviously you can't change those two things, but having speeds that you just go trail speed, you don't like get fed into some huge fast section into a massive jump and that sorts of thing. So trail design is really, really important, and that trails are planned from the outset. And there are now people who are specialised in trail design. And so for mountain bike parks to make sure they engage proper trail designers in their bike trails and consider emergency management from the outset.
Fair enough. Fair enough. And then someone has, do you have any data on collateral damage? So this is based off a story that they've just put in. Brian, I hope you don't mind me sharing the story, but they put illuminating presentation. My son was a keen mountain biker, was in with others who seemed totally oblivious to the dangers and came home with many injuries and some near misses. Going on a totally uncontrolled foot trail, which crisscrossed with pedestrians. Do we have any data on collateral damage? So I'm guessing that means with pedestrian damage and all the rest of it.
No, like I haven't seen any data on that at all. Yeah, bike people. So some mountain bike trails are purely mountain bike purpose built only, and pedestrians aren't allowed on them. I certainly know in my own area that the local government have built trails. They have the uphills are pedestrian and shared use with mountain bikers. The downhills are mountain bike only. You still get pedestrians on them, but at their own risk. Because yeah, people do go down them quite fast, and pedestrians. I've certainly seen in my own data. I haven't analysed all of it yet, but I've seen that there have been injuries of pedestrians in my own data on trails.
Perfect. And I think
There's
that's
no literature.
Nothing, no, fair enough. So I think that's everything that's come in. And someone has asked, and this might be pertinent to some other people as well, that if you did sign up to become a member this evening, first off, thank you so much. Secondly, you don't need to pay for the certificate. If you have, I'll find your payment and I'll refund it. But if you have signed up to become a member this evening, do not pay for a certificate. You will, I'll send it to you first thing tomorrow morning. So that is all that we have time for this evening. So Gill, thank you so much for joining us this morning. I hope that you managed to go get yourself, of course, get yourself some rest or a hot coffee before you actually have to start your day. Thank you so much. We do really appreciate you getting up early to join us and give us such an informative talk. Thank you as well, of course, to our sponsors, as always, to QualSafe, who I say proudly sponsored by, and they proudly do sponsor us. We are very, very glad to have them on board. I know that Toby and Nigel managed to catch Keith at the Emergency Services show this week. So thank you very much to those guys for their continued support, for always coming and helping us out with different conferences and talks and all sorts of wonderful things. And of course, our long-standing wonderful friends over at Gill, and they've been proud sponsors of us for a very long time, and we are very, very proud to have them on board. I can't really say too much about them because of the legislation behind what they do, but if you do want to find out more about them and find out the mystery of that, do scan the QR code that's on your screen now, or go to galen-pharma.com to find out more. So from everyone here at Trauma Care, I've seen a few people from sort of around the world, middle of the sea. Unfortunately, no one from Australia this time round, which is sad. We had 3 people in on Tuesday from Australia, but thank you very much. Wherever you are in the world, stay safe, look after yourselves, look after your loved ones. Gill, thank you very much for joining us, and good evening, everyone. Goodbye.